Okay, so now that we've talked about kind of the elements for establishing service connection in the first place, we're going to spend just a little bit of time talking about, once that service connection has been established, how a rating works. I touched on this a little bit earlier, but basically a rating of a disability is based on how that disability affects the average person's ability to work. So if a veteran is rated at 70% for post-traumatic stress, that's the VA saying we believe that the average person with these symptoms is 30% employable, and they are paid out accordingly. You've seen this chart before. This reflects kind of what benefit is available for what level of rating. Most of the folks that we work with are rated for multiple disabilities. Like I was saying earlier, you could be rated at 10% for mild hearing loss, and maybe 70% or even 100% for post-traumatic stress. It's important to know that these percentages are not simply just added together, although that might make the most sense. So a veteran that's, for example, rated for 3 disabilities at 10%, 20%, and 50% is not just simply rated at 80%. There's an unnecessarily complicated mathematical equation for determining what that veteran's total disability is. I'm not going to go through the math because you can Google it and figure out, based on the VA's ratings tables, kind of what percentage you might be looking at for the veteran that you're working with. Say if they're maybe already rated at 30% for something and you think that you can get them, say, 50% for major depressive disorder or some other disability. Here's an example of what the 50% rating looks like in the mental disorders ratings table. Again, these ratings tables are in the Code of Federal Regulations, 38 CFR, and they're explained in more detail in treatises like the VBM, the Benefits Manual, and others. A couple important things here, and they're really kind of, I think, issues with the way that this is done, and things to think about when you're working with your clients. The VA does not have separate ratings tables for separate mental health disabilities. So a veteran that's diagnosed with schizophrenia versus PTSD versus depression is all going to be rated based on the same ratings table and the same very general set of symptoms that may not necessarily apply at all to the symptoms that they are actually experiencing that nevertheless do impact their ability to work. So that's frustrating. I think it would be a lot more straightforward, certainly for unrepresented folks, if ratings tables more accurately reflected the impairment on their ability to work and their symptoms. But what that means for us, both in working with the veterans and in working with their doctors, is being able to help them use some of this language to describe the symptoms that their veterans are facing, even if they may not necessarily be on here. So for example, panic attacks more than once a week. The veteran and his doctor might describe a symptom of PTSD as hypervigilance or anxiety or always being on alert. That would probably fit under that example for panic attacks. If they're always on alert or always hypervigilant, it may actually be more like 70% or 100%. However, if they say that and not maybe some of this more kind of generic and frankly less helpful language for treatment, there might be issues in getting rated. So just something to think about moving forward as you work with your veteran to write a stressor statement, or maybe work with a doctor in putting together a letter of support where they're describing symptoms. Another thing to take into consideration when you're talking about ratings tables is what's called total disability based on individual unemployability. I'm going to breeze through this. This may end up impacting some of the clients that you're working with, so we can talk about this more in practice. But essentially what it allows is for a veteran who truly cannot work because of their disabilities, and they've demonstrated that either through their doctor or through a lack of a work history, say for the last few years, but their symptoms don't square with the 100% rating, they can actually get paid out at the 100% level without getting rated schedularly at 100%. Which, if you remember back to the charts, is a big difference. 70% rating is about $1,400 a month. 100% rating is about $2,900 a month. So if your veteran really has had difficulty working because of their service-connected disabilities and the VA nevertheless is not rating them at that 100% level, we can talk more about what it means to advocate for what's called TDIU.
Can I ask a question?
Yeah.
Benefits if, for example, they have that rating but there is some work they could still do? In other words, does what they do in job and income later on affect what they continue to get?
Yes. So, and that's a great question, and I can unpack that a little. So, a veteran, let's say you've got a veteran that's rated for, a variety of different disabilities, and that equals out to 80 or 90%. That veteran has no restrictions on working. He or she can have a job, whether it's part-time or full-time, and still collect their disability benefits because, again, it's based on the average impairment, and there's no income restrictions like there might be for like SSI, for example, if you're familiar with like Social Security disability benefits. That, though, changes when we're talking about this benefit, TDIU. So for veterans that are on TDIU, because it's based on their own subjective or individual unemployability, that veteran, if they were to begin working, and you want to make sure that you advise your clients of this, especially if they get it, would need to let the VA know right away, because then their rating would be, it wouldn't be reduced, but they would stop receiving IU and then go back to receiving whatever they were schedularly rated for. So they would go from the 100% payment back down to 70 or 80%. But then again, they'd be working and they'd have that job and they'd have a second income. And, if they're doing that, that obviously means that things are going well. So it's a balancing act, but that's a great question. Again, running through this, there's some, I guess, more kind of narrow examples of other types of disability benefits that we need to cover for the MCLE that you're probably not going to run into. Special monthly compensation are additional benefits awarded for certain severe disabilities. And again, these are awards based on diminished quality of life. So typically this involves like a loss of use of an extremity. You can get certain special monthly compensation benefits if there's, lost a hand, lost a foot, disabilities related to eyesight, sense of smell, things like that. So if that comes up in your cases or you think it might even be an issue, let us know and we can discuss it. It's a pretty narrow set of circumstances, though. Okay, so this may come up, and I will spend a little bit more time talking about the two most common defenses to service connection. And those are that the veteran's disability pre-existed service or that the veteran's willful misconduct caused their disability. So I'll talk about pre-existing condition first. Veterans are entitled to what's called the presumption of soundness, which basically means that if they entered service, they went through a medical entrance exam, and there were no disabilities noted on that entrance exam, they were presumed to be a healthy person. This is good because it prevents the VA or the military from coming back when they are discharged and saying, we didn't catch this thing when you entered and we let you serve for 4 years, but really now we believe that like you actually had this, this mental health issue prior to service. The only way that they can rebut that presumption of soundness is through clear and unmistakable evidence that the injury or disease existed before service and was not aggravated by service. This is a really hard burden to meet. It doesn't mean, however, that the VA doesn't regularly screw this one up too. I was working with a veteran who we were trying to get service connected for really severe migraine headaches that started while he was in service. The migraine headaches were actually a manifestation of kind of the residual unfortunate effects of military sexual trauma, a rape that he'd experienced while he was in service. Almost immediately after that, he started experiencing headaches that were putting him in the hospital for kind of days at a time. Not surprisingly, the only thing that was treated at the time was the headache. There was no record of the rape or the sexual trauma in his military records. But at some point in that record, he had told a Navy doctor who'd probably asked him a question about his history of headaches. Oh, when I was a kid, I probably had like 3 or 4 headaches, and I remember having to like stay home from school. The VA tried to use that in-service medical record to prove that his hospital-worthy migraines pre-existed service. Obviously, that doesn't meet this burden, but when you're dealing with folks at the VA who may not be lawyers, especially kind of this initial stage of appeal, and don't understand burdens of proof, you get mistakes like this all the time. I don't think this is going to come up in the cases that you're working on, but it's important to kind of know that it may be an issue. And then even if the pre-existing condition was noted on a service exam, like at entrance, the veteran can still get service-connected benefits if his military or her military service treatment records bear out the fact that military service made that condition worse. You don't get to benefit from the presumption of soundness, but you can still get benefits for it. And then that other defense that I was talking about, that the veteran's willful misconduct was the proximate cause of the veteran's injury, that would bar a veteran from, receiving benefits. Important to realize here a couple things. Mere reckless behavior does not rise to the level of willful misconduct, and there's some pretty good case law that bears this out. And it's important to focus, I think, at times on that proximate cause language. The veteran that I was talking about earlier that was diagnosed with schizophrenia in service, and then they changed the diagnosis. When he applied, before I started working on his case, when he applied on his own for service connection for schizophrenia, he was actually denied on the basis that his schizophrenia was caused by his drug use. So we had to go back, look at his records. One of the things we saw was that he started to manifest what very clearly looked like symptoms of schizophrenia first, and then some of the non-judicial punishment and issues that he got into with drug abuse started to pop up after kind of those first manifestations. So obviously that brings into question whether or not, the drug use was actually the proximate cause. My argument was that it wasn't, and we won the case. But it's, something to think about. Just the fact that there's misconduct in a record shouldn't stop you from trying to get around that to get the veteran benefits. Here are some of the most common service-connected disabilities. A lot of the ones we've talked about, again, type 2 diabetes or diabetes mellitus on there, in large part because of how exposure to Agent Orange has been recognized as a link to type 2 diabetes. I'm going to talk really briefly about kind of the other type of monetary VA disability benefit that veterans can get. It's non-service connected pension. For those of you that are familiar with the Social Security benefit system, this is a lot like SSI in the sense that it's a benefit for very low income veterans who are unable to work because of their disabilities. Important to know here, these disabilities do not need to be connected to service. It's just what they have now that prevents them from working. Veterans of any age can receive this. They just have to have served during a period of war and, like I said, either be totally and permanently disabled or be over the age of 65. So it basically operates like a safety net benefit for low-income vets. And then here is what the periods of war are. You can Google this, very easily if this comes up. It's not going to come up in either of the cases that we have today, but it could. And again, here's kind of an unpacking of what total and permanent disability looks like in the regulations. So veterans can qualify for both pension and compensation. They can't get both at the same time, but they'll be entitled to whichever is the greater benefit. So as you can see here, pension is $1,075 a month, 60% is $1,059. So in that example, assuming that the veteran has no income, if he qualified for both, the VA would give him pension. It's important to understand, though, that pension, because it's income dependent, goes down if the veteran has any other income. So let's say he's also getting $500 a month in Social Security retirement benefits. He would only then, in this example, be entitled to $575 in pension. So all of a sudden, even though 60% is less than pension, he would qualify for the 60% compensation because he would be able to add his $500 a month in Social Security retirement benefits to the $1,059 he gets in compensation. Because again, like I was saying earlier, there's no income restriction when it comes to service-connected benefits, except if you're talking about TDIU.
Is the pension taxable?
No, neither.
Oh, the pension's not.
Yeah. Yeah, both are tax-free. Another benefit to consider is aid and attendance. This is kind of a stepped-up benefit for folks that are receiving both compensation or pension, but it's given to veterans whose disabilities require assistance with ADLs, or activities of daily living. So bathing themselves, clothing themselves, medication management, ambulation, getting to and from. I don't think this is going to be an issue with either of the folks that you're working with today, but it's something to consider if you find yourself, I think, especially working with elderly veterans or veterans that might qualify for nursing home care. This is a benefit that can go towards helping to pay for that type of skilled nursing facility, and is oftentimes a benefit that more kind of middle and upper middle class, veterans might still qualify for, especially as they get older and start to incur pretty significant nursing home bills and things like that.
And
So
not related to an injury or trauma.
it can be both. So it doesn't necessarily have to be, again, for the pension and the aid and attendance, they can only qualify for it via the pension route if they served during a period of war. So a lot of World War II veterans, and we'll start to see sooner rather than later Vietnam War era veterans as they get into their late 70s and 80s and 90s will start qualifying for this benefit if they're in some sort of skilled nursing facility. Survivors benefits, again, this is not it's certainly not in the cases that you're working with now, and it's very unlikely that we would ever give you a case for dependency and indemnity compensation, again, because we work almost exclusively with veterans themselves and not necessarily veterans' family members. But basically, a veteran who either dies during service or dies from service-connected benefits, dies from a service-connected cause, their survivors, whether it's a spouse or a dependent child, can be entitled to a percentage of whatever they were receiving in service-connected benefits. So Melissa's going to talk now briefly about kind of the procedure for filing these cases.